guys, it's Dr. Megan Lott with Bellevue Specialty Eye Care. This is part 3 of discussing Stephen Nedoroscik, U.S. Olympian with a silver and a bronze medal so far. And we are discussing his 2 eye conditions. So part 3 is going to be the treatment that we would perform here at Bellevue Specialty Eye Care if Stephen came into our office. So, which would be really cool if he did actually. So let's see if we can make that happen. The first thing we're going to talk about is the part 1 video, and we touched on this a little bit, talking about strabismus. And strabismus is the 2 eyes not pointing to the same place at the same time. You know, kind of like when he dismounts from the pommel horse and his feet come together and hit the mat at the same time. So same thing we want with our eyes. The eyes are a little difficult to train because we're talking about such tiny muscles, but we train the brain to coordinate the eyes, just like Stephen coordinates all the things he's coordinating while he's on that pommel horse. A lot of athletes, even without any kind of eye conditions like strabismus, still come to us for sports vision therapy. And what that is it's getting the eyes to recognize faster, the eyes and the motor system, whether that's eye-hand coordination, eye-foot coordination, whatever sport it may be, just to be able to react faster. So vision therapy is not just for those patients with eyesight conditions like Stephen, but also patients that just want to up their game to the next level and maybe become an Olympic medalist. The other condition that Stephen has that we talked about in part 2 was coloboma. Now, I did a little digging on the internet, and I don't know what exactly type coloboma Stephen has, but in my internet research, I did see that Stephen doesn't drive, it appears. And so patients sometimes that have an eye disorder that causes them to have poor eyesight, they may not can pass a driving test. So what can be done? In most states, patients are allowed to drive with what's called bioptic lenses. What these are essentially telescopes mounted to the top of the lens so that when a patient approaches anything that they need to see better, they will just simply dip their head, look through the telescopes, and then go right back to driving. Bioptic telescopes can be used for more than driving. They can be used for anything that you're wanting to see at a distance to enlarge things, like maybe going to the Olympics and seeing the U.S. bring home all of their medals. So if we can help you, give us a call here at Bellevue Specialty Eye Care. But thanks for hanging around and watching these 3 videos and learning a little bit more about eye conditions and a really awesome U.S. Olympic medalist. See y'all soon.